name is Cheyenne Purtee, and I'm going to be doing a pediatric medication administration today. I'm going to be following my general safety principles and practices throughout the entire procedure. So to start, I'm going to show you the IM injection sites. So for infants or children, we want to, for the deltoid, it's going to be 1 to 2 finger breaths depending on the size of the infant below the acromion process, and then you're just going to give the shot right here. For the ventrogluteal, you want to locate the greater trochanter and place your palm of your hand there. And then you're going to have your thumb toward their groin, the index finger pointed toward the iliac spine, and the middle finger pointing toward the iliac crest, and you want to give the shot here in the V. And then for the vastus lateralis, you're going to have the greater trochanter here, and you're going to locate the patella, and then you're wanting to give that shot in the inner third of the outer thigh. So now that we've got our IM injections, for the IV sites, you've got the frontal here, the temporal here, the auricle, you've got the basilic, the cephalic, the median, and the median cubital here. You've got the great saphenous here, and then the median marginal here. When administering medication, you want to make sure that you follow the 6 rights of medication administration. So that's right patient, the right medication, the right dose, the right time, the right route, and the right documentation. So for your first check, you're going to do that with the order, and you're just going to verify the medication that you're giving with the order the doctor's written. Check 2 is going to happen at the MARA. You're going to go through your 6 rights again, and then you're wanting to make sure that you check for any allergies, expiration dates of the medication, and you also want to do any drug calculations that you would need to do because it is on a pediatric client. And then check 3 is going to be at the bedside. So once you have your medication ready to administer, you're going to go to the bedside and check your 6 rights again. For oral medication, you may want to swaddle the infant if you can, and then you just want to have a seat and have them sit in your lap. Place your hand over their arms, and then your medicine that's already drawn up, you're going to give it to them in their mouth, and then you may have to stroke their cheek or under their chin to help promote swallowing to get them to swallow the medication. For eardrops, for any child that is 3 years or younger, you're wanting to pull the pinna down and back, and then have their head turned to the side, pull the pinna down and back, and then you're going to want to administer those eardrops, but you want to let the eardrops go into the ear canal on their own in their own time. You don't want to force anything. And then as far as IM injections, the most common for infants is the vastus lateralis. So to help restrain if necessary, you want to put your arm lightly over the baby's abdomen, straighten the leg out that you're going to be giving the injection in as much as possible, and you want to inject right here in the inner third of the outer thigh, and that just helps keep the baby's arms from failing and causing an injury. So when giving medication, you want to make sure that you've got a good relationship with the parent, and you want to make sure that you have a good rapport with them and the infant. You also want to make sure that the infant and the guardian have a good relationship shown as well. You want to provide the parent with any information about the medication name, why the infant's getting the medication, any possible side effects or adverse reactions the medication could cause. You want to tell them if they need to expect a slight low-grade fever with their infant after medication, and just provide them with any information they need for when to contact the provider or seek any additional medical attention. So that's it for my video. Thank you for watching.